Hello, my name is Dr. Irvin Sani, and I'd like to speak to you about a procedure called kyphoplasty. Kyphoplasty is a minimally invasive procedure that's used to treat vertebral compression fractures. Vertebral compression fractures are the result of poor bone quality. All of us, as we get older, from about the age of 35 on, start to lose bone. Depending on our diet, what toxins we bring into our bodies, such as alcohol and nicotine, and our level of exercise and our genetic factors will dictate how quickly we lose that bone. People who lose bone rapidly will first develop what's called osteopenia and then ultimately develop what's called osteoporosis. Osteoporosis is a pathological or severe thinning of the bones that can result in wrist fractures, hip fractures, and what we're going to talk about today, vertebral compression fractures. This is a lumbar spine, and although vertebral compression fractures can occur anywhere in the spine, they most commonly occur in the thoracic spine and in the lumbar spine. The bone of the lumbar spine is made up of two types of bone, the cortical bone and the cancellous bone. The cortical bone is the hard outer shell, and the cancellous bone, which you cannot see here, is the inside of the vertebral body. It's a spongy type bone, and as you get older and you start to lose your ability to build strong, healthy bone, that sponge becomes thinner and thinner to the point where a simple sneeze can actually result in a vertebral compression fracture. And although a sneeze can cause a compression fracture, most commonly they're caused from bending over, lifting a heavy object, or maybe even falling from standing. If you are elderly, over the age of, say, 60 or 70 years old, and you have severe back pain anywhere from the base of your neck down to your buttocks, after lifting, bending, stooping, or maybe a fall even from standing, you may have a vertebral compression fracture. These are commonly misdiagnosed. I see them routinely from primary care doctors who just didn't recognize or realize that the patient had a vertebral compression fracture. Or sometimes patients have severe pain after one of these falls and just simply don't go to the doctor because they think they have a sprain or a muscle injury. Vertebral compression fractures can be devastating. They're painful. They can affect your appetite and cause a condition called anorexia. They can cause abdominal pain. They can cause poor posture. And in extreme cases, a vertebral compression fracture can even result in paralysis. So what I often tell my patients when I'm speaking to them about their vertebral compression fracture in clinic is what I call the 3 Ps: pain, posture, and paralysis. People who have a vertebral compression fracture very often have pain. And that's usually the reason that they come to me or the reason that their primary care doctor referred them to me. But what is also very important is posture and also paralysis. When you have collapse of your vertebral body resulting in a vertebral compression fracture, this can result in a condition called kyphosis. And kyphosis is simply a curvature of the back when you're leaning forward. A person who has kyphosis looks like they're leaning forward in this type manner. This can affect your sagittal balance, or in layman's terms, this can affect your ability to balance your head over your pelvis. And if you're thrown very far forward, it can make it difficult to walk. So sagittal balance is very important. And if you have multiple vertebral compression fractures down around the lumbar spine or the low thoracic spine, this can actually affect your abdomen to the point that it becomes very difficult to eat. Not only painful, not only poor posture, but even difficult to eat. In some more rare cases, we even see paralysis. And what happens is the vertebral body collapses to the point that bone fragments are now pushed posteriorly into the canal, compress the spinal cord or the nerve roots in the lower lumbar spine, and can put the patient not only in severe pain, make it difficult to walk from a balance standpoint, but actually compress their nerves and paralyze them. If this were to happen, if you were to get to this point where you had a severe compression fracture that's compressing your neural elements, unfortunately, the treatment at that point would be what's called an open decompression infusion. We would literally have to make a large incision, open up the bony canal, remove the pressure from the spinal cord, and typically stabilize the spine with 4 screws above the fracture and 4 screws below the fracture. This is a very large surgery, requires inpatient hospitalization, typically results in significant blood loss, and creates risks, high risks, such as infection, pneumonia, DVTs, etc., and in all cases will result in extended recovery. This is why patients who have a vertebral compression fracture that hasn't gotten to this point will oftentimes undergo a kyphoplasty. A kyphoplasty is a very minimally invasive outpatient procedure whereby we place a needle using an X-ray camera into the vertebral body, insert a balloon, reinflate that collapsed body, and then fill it with cement, a special bone cement that's been used for over 30 years and is known to be completely safe. This cement renders that body fixated and makes that vertebral body so strong that I could literally beat it with a hammer and it would no longer collapse. This reduces the patient's pain, oftentimes corrects the posture, and eliminates the risk of paralysis, all with a 1.5 to 2 millimeter incision, the tip of a pencil, and a procedure that can be done in the office or in the hospital as an outpatient, and the patient can go home just shortly after the procedure's been completed. One thing to understand is that when we treat a vertebral compression fracture, we are not treating the underlying problem. And it's very important that you address as best you can, depending on your circumstances, your osteoporosis. Once you've been diagnosed with a wrist fracture, a hip fracture, or a vertebral compression fracture, such as in our spine practice, then it's very important to go back to your primary care doctor or talk to us about getting on a medication to strengthen your bones. So in conclusion, vertebral compression fractures can be devastating. They can often be missed by the primary care doctor or even by the patient and thought to be a sprain or a strain. However, if your vertebral compression fracture is diagnosed early enough, it can be treated with a minimally invasive outpatient procedure in and out the door in about an hour. However, if missed, can lead to a debilitating, large, open inpatient hospitalization that could take years to recover from. If you have sudden pain in your back after falling, twisting, lifting a heavy object, or even sneezing, call our office immediately and get scheduled for an X-ray.